Sam. I'm the Director of Respiratory and Pulmonary Services at Hartford Hospital. If I may ask everyone to put their phones on mute while we have this conversation, and we can open back up when we have questions. The reason why I'm here today is to bring forward this new innovative method of ventilating more than one person or one patient at the same time. So technically right now, two patients at the same time simultaneously. So we have created this in response to the current pandemic that's happening all across. And that has been in a partnership with all the respiratory therapists here at Hartford Healthcare. And the reason why we're here today is to bring this forth as an ability to provide this ventilation in case of large amount of patients that are currently going to have the need to be ventilated. So there's a multitude of variables, and it's going to be in close collaboration with our pulmonary and critical care physicians. And those variables are, like the patient's age, length, the patient's weight, the patient's compliance or lung elasticity. So I would recommend that everything is being done with collaboration with the healthcare team. And this is a very vital procedure that we were implementing in order to have our patients have the ventilator support that they need in case of emergency.
This is something that you can do, but you implemented it now.
Correct. This is something that like we always had the capability of doing, but we have finalized it recently in order to provide the support needed for our patient population.
Walk us through the process.
So the process is we're going to use one ventilator, and like in case you see the video afterwards, this ventilator is split up in, it has like a dual limb tubing that's going to go to two separate patients. We do have filters in line, viral filters that protect the patient, the workers, and the environment from inhalation and exhalation of, like patients' gases. Those are being split up in two, and both inhalation and exhalation, and both patients are being ventilated simultaneously. The benefit is to provide ventilatory support for more than one patient in case of, like an overflux of patients in our facilities that need ventilatory support.
How long can you be?
The length of staying in this procedure can vary, but can vary anywhere between 5 days to 12 days. Any questions?
Are you at the point yet where you need to use this, or are you going to kind of save this for when there's a surge and the hospital's overflowing?
We are not at the point of using this. We are providing like support for all our patients currently in our facility, and this is only at extreme emergency when we're going to have, when we're ready for it.
So are there kind of downsides, or what are the dangers of using this kind of technology? Like, why isn't it the status quo to use something like this?
Well, for using something like this, currently, or any normal business would be to have one device per patient, to be compliant with infection control and standard procedures. We do not use this, on a regular basis. This is only for emergency situations. The dangers of using this is, it can be a variety of items, which can vary from patient to patient. That's why it's important to evaluate all the variables among the critical care physicians and the healthcare team. Any other questions?
So do you definitely anticipate that you'll need to use this in the next few weeks or months, or are you hoping that it won't get to that point?
Well, I'm hoping we're not going to get to the point, but we're ready if that necessity arises.
Thank you.
Any other questions? Thank you, everyone, for being on the call.